Which patients should avoid splenectomy?
There are some types of autoimmune hemolytic anemia in which splenectomy is discouraged. First, if the red cell destruction does not occur mainly in the spleen, which is the case in cold agglutinin disease and secondary cold agglutinin syndrome, where the hemolysis primarily occurs in the liver, and in the very rare PCH, where the hemolysis is intravascular. And then this patient had a DAT-negative autoimmune hemolytic anemia. And in mixed autoimmune hemolytic anemia and the DAT-negative cases, we usually discourage splenectomy because there are no studies particularly looking at these subgroups. So there is really no evidence in the literature for effect, and clinical experience is generally negative. I have been talking with my friends and colleagues in Milan, Italy, which is a very large center for treatment of wAIHA, and they don't use a splenectomy in these two subgroups because of negative clinical experience.
Okay. So can we, when we say these are the condition that we should be avoiding, so is that because DAT negative or mixed AHAs, do they have less response to conventional treatment for wAIHAs?
I don't think you can say that about the DAT-negative cases, but the mixed autoimmune hemolytic anemias is a difficult group to treat. They may have poor response to steroids, and most experts think that they should be initially treated by a combination of high-dose steroids and rituximab upfront. And if they have clear features of cold agglutinin component, which may be the cause, then one should consider treatment like cold agglutinin disease. In addition to the groups in which splenectomy is discouraged because poor documentation or lack of effect, there are also some contraindications. For example, we are reluctant to doing splenectomy in patients more than 60 years because of the risk of complications, and also in SLE, splenectomy is discouraged. You know, wAIHA may in some cases be secondary to SLE, and we think those patients should not be splenectomized.
Follow BMF Cases for the latest updates and insights on classical hematology.